At first, I'm going to perform my hand hygiene. I'll gather all the stuff which I require for my patients. Then I'll go to my patients. I'll knock at first. Then I'll go inside. Then I'm going to start introducing myself. Hello, I'm student nurse Hesal Tamanglo. Today I'm going to do your wound assessment. Can I know your name? Is Matilda Jackson. And can I know your date of birth? 2010 January 14. Okay. Okay. For privacy, I'm going to close the curtain. I'm feeling comfortable. Yes. Today I'm going to do the wound assessment and I will make the sterile fill for you. Is it okay? Is it okay? I will do your wound assessment. Okay. Do you want to go to washroom anywhere else? No. You don't feel any discomfortable, right? Everything is good, right? Now I'm going to raise the bed according to my bed hip size. This is my comfortable hip size. Now I'm going to wear the gloves by doing some hand hygiene.
For me to be able to I'm gonna move the table
now I'm going to remove your dressing. Is it okay, right? Okay, I'm going to put it in the dustbin and
then I will
I'm going to measure its wound. At first, I will check your wound by using the reader. There is a presence of redness and edema. Yes, there is. Maybe there is. Let's check. For edema, it's 1.2 centimeter edema, and for the bruising, there is no available of the bruising. So for discharge, it looks like it looks like serosanchez. The dressing looks like serosanchez. It has little bit red on it, blood on it, and it has like 45% of blood on the dressing. So I'm going to measure the wound with this stick. At first, I'll measure the length. For the length, it's quite large length. So the length is.
So I'll be using the
Let me measure the length.
mouth.
How much is the length?
I'll put
Is 13 centimeter. The length is 13 centimeter.
I will
The
put the
width.
and squeeze.
The width is here.
First
So
of all, I'm going to
the
do
width is
from the upper. In case there's any drainage, if you go to the lower, then I can
4 centimeter. The width is 4 centimeter, and the depth. Depth is
upper,
and then I'm gonna use
bottom.
how much is the depth? The depth is 3 centimeter. And for the
I
tunneling,
go again.
I didn't see any tunneling here, but the wound is open up wound. It's open up with it's open up wound, so I have to prepare a wound care for it.
so I'm just gonna do
So
Do you feel any pain?
for that, I will remove the gloves first by gloves to gloves contact. I'll pinch it, then I'll just take it out and roll it. Then skin to skin contact. I will take it out like this and I'll throw in the garbage. Then I'll perform the hand hygiene. Then I'll put the things aside, which is not necessary for here.
So now I'm
And
going to
I will
bring
wipe the
the
surface
base of the
for to kill the any germs.
Are you okay? You feel any pain? Just lift
I'll
up your
just
hand.
wipe my surface.
Then
Then
now I'm going to be doing
I'll throw it in the trash. Then after I'll perform hand hygiene again. Let it dry.
garbage.
Then after
Then now I'm going to be
I'll put this one here. I
testing
need
for
this
the
one. I will
reflex.
rip it up carefully. I can use it as a dustbin also in case there is no presence of dustbin. But now we have a dustbin, so we don't need it. I'll just throw it here. So now I'm going to open this one. At first, I will flip this one 2 centimeter away from me. Away from me, I can toss 2 centimeter here. Then I will
So you see,
flip another one.
so I'll just turn it off,
I'll just flip another one.
take it out.
That is also away from me.
So what I
Then
need to do is to tap it.
I'll flip the next one.
Yeah,
I'll
okay,
flip the next one, touching only the 2 centimeter. 2 centimeter,
so I put this away,
and then
away.
for the next one, I should be careful because I have a forceps. I shouldn't touch the front of the forceps 2 centimeter, which is sterile. I will only touch the base one. Then I will manage it
I'll be doing some exercise.
because I shouldn't touch this one. Then it will be contaminated. It will break the sterility rules. So with the help of forceps, I'll make it straight. Then
So I'm going to be putting
then after that,
putting this down
I'll put this one
so that I'll be
to
able to
the
work.
sterile field. Then I will do the banana peel for the gauze, which is needed for the wound care.
I will leave the patient for like 15 minutes because we just did oral care. So
And
that if there
I
is
shouldn't
anything, he can
throw
be comfortable.
anywhere.
Then
I just
later-
throw in the things which is need by doing banana peel. Then I will just garbage it. Then
Okay.
I'm going to wear the sterile gloves.
The
So I'll make some.
range of motion for my patient.
I'll make some
First of all, privacy.
place for my gloves. So
First of all, we're going to be starting with the
for the gloves, here is my sterile gloves. Make sure I shouldn't contaminated this. So I'm gonna open my gloves
section.
with banana peels very carefully. I will throw this one
I'm going to be doing
in the garbage. Okay, this is my sterile gloves. So I'm going to start open my sterile gloves. So I should be very careful with it. I shouldn't contaminated my gloves. So I should be careful with it. It has a direction showing how to open it. So I just open this. Then I push my first glove on my first hand. So for first glove, I put it successfully without. Then for the second one, and then I can do this and do this. In this way, my video is completed.